Are you suddenly feeling like your bathroom has become your second home? If you're pregnant and wondering why you're constantly running to pee, even in the middle of the night, you're not alone. Today, we're talking about one of the most common, yet least talked about pregnancy symptoms, frequent urination. What causes it? When does it start? And most importantly, how can you manage it without losing sleep or your sanity? Let's dive in. Hi moms! Welcome back to the channel. Today, let's have a real and honest chat about something almost every pregnant woman goes through, but hardly talks about: frequent urination. Yup, that nonstop feeling that you need to pee again, even if you just went 5 minutes ago. It can be annoying, inconvenient, and sometimes even a little worrisome, especially if you don't know why it's happening. But the good news? It's totally normal. Let's break it down: why it happens, when it happens, and what you can actually do about it. Why do you pee so much during pregnancy? Pregnancy changes almost everything in your body, including your bladder. Frequent urination is super common, especially during the first and third trimesters. Here's why. 1. Hormonal shifts. Hello, HCG. As soon as you get pregnant, your body starts producing a hormone called human chorionic gonadotropin, HCG. This hormone helps maintain the pregnancy, but it also increases blood flow to your pelvic area, including your kidneys. More blood flow equals more urine production. It's your body's way of flushing out toxins and supporting that growing baby. 2. Increased blood volume. Your blood volume increases by up to 50% during pregnancy. That's a lot more fluid circulating through your body, and more fluid means more work for your kidneys. The result? More pee. 3. Your growing uterus. As your baby grows, your uterus expands and starts pressing on your bladder, especially in the third trimester. That pressure makes you feel like you constantly need to go, even if your bladder is only holding a little bit of urine. 4. Relaxed muscles. Thanks to the hormone progesterone, the muscles in your body relax during pregnancy, including the muscles around your bladder. That makes it a little harder to hold it in, and you might find yourself needing to pee more often. When does frequent urination start in pregnancy? For many women, it starts early, as soon as 6 to 8 weeks into pregnancy. That's usually due to hormones and increased kidney activity. You might get a little break during the second trimester as your uterus moves up and away from your bladder. But don't get too comfy. In the third trimester, it usually comes back with a vengeance. Your growing baby pushes down on your bladder, especially in the final weeks, when the baby drops into the pelvis. At that point, it can feel like every step you take sends you straight back to the bathroom. Why is nighttime urination worse? Nocturia. You might also notice that you need to pee more at night. This is called nocturia, and it's super common during pregnancy. Here's why. When you lie down, fluid that was stored in your legs during the day gets reabsorbed into your bloodstream and processed by your kidneys. That fluid turns into, you guessed it, more urine. Plus, your baby might get more active at night, and that tiny dance party inside your belly can lead to pressure on your bladder. When should you be concerned? While frequent urination is totally normal in pregnancy, painful urination or a burning sensation isn't. Watch out for these warning signs: burning or stinging while peeing, cloudy or foul-smelling urine, lower abdominal pain or cramping, fever. These could be signs of a urinary tract infection, UTI, which is more common during pregnancy and should be treated right away. If anything feels off, don't hesitate, talk to your doctor. Tips to manage frequent urination without losing your mind. Now, while you can't stop your body from going through these changes, there are things you can do to make life a bit easier. 1. Stay hydrated, but smartly. Don't cut back on water. It's essential for you and your baby. But try to drink more during the day and less right before bed to reduce those midnight bathroom trips. 2. Empty your bladder completely. Lean slightly forward when you pee. This helps your bladder empty more fully, so you don't feel like you need to go again 2 minutes later. 3. Avoid bladder irritants. Caffeine can make things worse. It's a natural diuretic. Try to limit coffee, tea, and chocolate if your peeing frequency is out of control. 4. Plan your bathroom breaks. If you're heading out, especially in your third trimester, know where the restrooms are. Trust me, pregnant women develop a sixth sense for public bathrooms. 5. Practice Kegel exercises. These can help strengthen your pelvic floor muscles, improve bladder control, and even help during labor and recovery. Coping with nighttime trips. Here's the truth. Those 2 a.m. bathroom runs might be unavoidable. But here are a few things that can help. Limit fluids an hour or 2 before bed. Elevate your feet for 30 minutes in the evening to help reduce leg swelling and fluid buildup. Use a night light in the bathroom so you're not fully waking yourself up every time you go. You're not alone. So many pregnant women deal with frequent urination. It's annoying, yes, but it's also a sign that your body is doing its job to support your growing baby. Like many pregnancy symptoms, it's just temporary. Once your baby arrives, your bladder will start returning to normal over time. Until then, give yourself grace. Laugh about it if you can, because what else can we do, right? And remember, it's all part of this incredible journey you're on. If this video gave you some clarity or at least a little comfort, give it a thumbs up and share it with another mama who's tired of running to the bathroom every 5 minutes. And if you have tips of your own, drop them in the comments below. I'd love to hear from you. Don't forget to subscribe for more real, honest, and supportive pregnancy content. You're doing amazing, and I'm cheering you on every step of the way. See you in the next one.